everyone, welcome to my channel. So if you're new to my channel, my name is Destiny. I am a college lifestyle vlogger, and I also like to do videos on beauty, hair, and things of that nature. So today, if you clicked on this video, you probably want to know how to get a job as a dental assistant, and I'm here to tell you how to do it. After I graduated high school, I was unsure of what I wanted to do for a career, but I knew I wanted to do something in the healthcare field, but I didn't want to be a nurse. So I was kind of indecisive on what to do. After I finally decided, hey, I want to be in the healthcare field, I kind of took it a little bit further. What specifically do I want to do? And I talked to a few people, and I ended up picking dentistry. So when I picked dentistry, my main goal and focus was to be a dental hygienist. So after I graduated high school, I went to a college called Broward College. At Broward College, I was taking classes towards pursuing my degree in dental hygiene. But it was very hard for me. I've had a lot of challenges along the way. So I was like, you know what? Let me go ahead and start my AA. While I'm doing my AA, I'll be doing a prereq here or there towards hygiene, because you're going to be taking a lot of science classes and a lot of just classes that are very hard, require a lot of studying and things like that, such as anatomy. I also had to take chemistry. Classes like that you have to take in order to get into the program. So I also wanted to add in my AA so I can have, a few in humanities, a few easier classes to help me along the way, because I wanted to be full-time, but I also wanted to still work towards my goal and not have a heavy load of science courses under my belt. It got to the point where I was basically done with the prereqs for hygiene school. Only I hit a stumbling block and I did not pass Anatomy 2. I took Anatomy 2. This was my second time taking it, and I did not pass, but it was already time for me to apply for the hygiene program. I knew I wasn't going to get into hygiene, but I still applied anyways. And I was like, you know what, let me just apply for assisting and see what happens. I applied for the assisting position maybe in the month of January. I got my acceptance letter into the program in, oh my god, when did I get that acceptance letter? I believe I got that acceptance letter in May to start the fall of 2016. So I was super excited because this was me moving forward. Even though I hit a stumbling block, I never stopped. So if you're still not sure what you want to do, don't stop. Keep going. There's so many other majors and careers for you to pick from. But we're going to talk today specifically about dental assisting. I got my acceptance letter into the dental assisting program. They will require you to take a drug test. You will have to get CPR BLS certified, which is basic life support. And you do have to get those certifications before being admitted into the program. Also, will have to provide your immunization records. So all of that is a part of you just getting into the program. After you get in the program, I'm not going to lie to you guys, it is very, very intense. You're going to be in class from 8 a.m. to 5 p.m. every single day. This semester, it was every single day. The next semester, all we had was Fridays, and then it was just easier from there. After you get into the program, you're going to begin. They're going to teach you about teeth. You're going to take dental anatomy. You're going to take radiology. You're going to take dental radiology. You're going to learn how to take x-rays on the teeth. You're going to take a course called dental materials, where you're going to learn all about the materials that are used in dentistry. And they just really are going to prepare you. I went to Tallahassee Community College here in Tallahassee, Florida, but there are so many schools that offer the program. If you live down south Miami area, Broward College does offer dental assisting. It's just that their prereqs are a little bit different. Another reason why I ended up moving here to Tallahassee, not only did I want a change of environment, but I really didn't want to have to take the HESI exam to be able to qualify for dental assisting or dental hygiene, because the HESI exam is going to require you to know about anatomy, and at the time when I wanted to apply to take the HESI exam, I didn't take anatomy. My school, Tallahassee Community College, did not ask for any of that. I just got my job. I just got hired at a local dental office here in Tallahassee. And with me personally, no, I did not graduate the program. Unfortunately, I was supposed to finish this summer, but I wasn't able to finish. I did a whole life update about it and everything, but mainly what happened was I did not pass dental radiology. In my school, you need to pass every single course with a 75% or higher. If you do not pass with a 75%, you you fail the class and you're out of the program. I didn't pass dental radiology. I had a 73% in the class. Like I said, I needed a 75, so I didn't make the cut and I was released from the program. Luckily for me, within those 2 semesters, I got real world experience inside of my internships. That's something that I use as job experience. I also got my certifications, so I am a certified dental assistant. I am certified to do expanded functions. I, however, am not certified to take x-rays, but if you're in a situation like I am, you can always register at another school like the University of Florida or Panama City or anywhere in your local area to get that course done. I know UF charges a $400 fee to get your dental radiography licensing or whatever you want to call it. The practice that I work for is luckily allowing me to be able to start and take that course whenever I have the time to take the course. They're not in a rush about it because they're just happy that I have real world experience. Let's get started on how you're going to get the job. If you want to be a dental assistant, yes, you can do on-the-job training. Yes, they do offer on-the-job training. You do not have to go to school, but it is more guaranteed for you to actually get a job in this field if you have some background knowledge. If you go to a trade school, vocational school, whatever you want to call it, a community college, and take that course. Everybody does not have to go to college. College is not for everybody. Some people are hands-on learners like I am myself. I'm a hands-on learner. I need to learn. I need to physically put my hands on that thing to know how to do it. That's what you're going to get. You want that knowledge. They're going to teach you about the teeth. You're going to understand what an abscess is. You're going to understand why braces take so long. You're going to understand how a cavity is formed. You're going to understand the difference between a composite, which is a tooth colored filling, and an amalgam, which is a silver filling. You're going to understand why certain things cost more than others instead of just trying to apply for the job and be on the job trained. I have met a few people and shadowed under a few people who were on the job trained, and it's just taking them a little bit longer, but it can be done. To be honest with you, they will probably pick someone who has gone to school for dental assisting for this specific trade than picking someone who wasn't, if you get what I mean. You do have to wear a uniform. As far as your appearance, your nails need to be cut short down. Right now, my nails are actually too long, and they're not even that long, but these are too long. You have to be having short nails, clean nails, because you're wearing gloves, you're in someone's mouth. Nobody wants you with your stiletto nails in their mouth. Sorry girl, you gotta lose the nails. No nail polish. You have to have your hair back. So how I have my hair right now on the side, no, that won't do. When I'm at work, I keep my hair braided to the back. So if you have braids or whatever, you're gonna need to wear a bun, a ponytail. Your hair needs to be back. You need to wear a mask, so I would not suggest makeup. On days when I wanted to wear makeup, all I would do is maybe fill in my brows and put on some powder. To be honest with you, even that is kind of like doing the most, because your powder is going to come off because you're going to be taking your mask on and off. You also have to wear safety glasses. So if you're not willing to wear the uniform, if you wear scrubs how they're supposed to be worn, or whatever the case may be. There was a student in my class, she really wanted to wear her nail polish, and that was an issue with her. No nude nail polish, no clear nail polish, no nail polish at all. And that's how you want to present yourself during an interview. So I would have graduated in July, but I was released from the program I believe in May. So that means that I was not able to do summer term, which is okay. I feel like I've gotten enough knowledge, I've worked enough, I've built enough connections to know how to get the job, and that's basically what I did. As soon as you're released, as soon as you're done with that program, you want to get your certifications in your hand. You want to get your resume updated. I went to FAMU University and got my resume updated. I went to the Career Help Center. So if you're able to take your resume to a community college, you can also take your resume to somewhere like a career place that helps you find jobs. I also went to career centers when I started looking for a job. Okay, so you want to make sure that your resume is good and that you have your certifications. If you're not going to go to dental assisting school and you just want to see if you can get the position through just, applying, then you're going to want to at least have your CPR certification, at least. That's the least Like, that's at least what you want to do. After you've gotten your certifications and everything like that, got your resume updated, it's time to start looking for a job. So what I did, I went on Indeed.com. I also went on Dental Post, and I also asked my professor who's hiring. You want to use your connections, you want to use who you know, and you want to find out who's hiring in your city. You don't want to waste your time applying at places that are not hiring. Now, some places, if you call, they're going to tell you no, we're not hiring, but you might need to go in person and drop off your resume. Just be bold about it. You're trying to get a job. You're trying to show that I want this job, I'm passionate about this field, and I want this job. That's how I went about it. My first interview was, all my interviews were here in town. My first interview, this is my first ever dental interview. I'm not going to tell you guys where it was, but it was a very, very long process, and they asked me very specific questions. They asked me how would you assist the dentist with doing a restorative work, which is doing like a filling. How would you take a PA x-ray? What do you do to get a patient who doesn't want to comply? How do you respond to children? How do you work with others? Questions like that is what they asked me. They also let me meet the dentist, and they gave me a tour. Just because you meet the dentist, just because they gave you a tour, it doesn't mean you got the job. That's just what they do. Dentistry, you're going to be working very, very closely with your dentist, so the dentist needs to like you. That's my first interview. The next interview I had was at a company. It was more of a corporate dentistry company. So that was new for me. I didn't really expect to go to corporate dentistry, which what I mean by corporate dentistry is basically they have a chain of dental, and they have a chain of things. It's kind of like fast food for dentistry. So you can have maybe like one or two of that same place in your city, if you know what I mean. I had another interview, and that interview was very quick. Actually, I came in, I dropped off my resume. As soon as I dropped off my resume, the lady asked me to come in the next day for an interview. I came into my interview. Make sure you show up for your interviews early. You want to be at least 15 minutes early, even if you're just sitting down there sitting. Also have paperwork for you to fill out. So I did fill out a form, got my interview. She basically asked me, why do you want to work here? And I told her, you want to make sure that you research that company. If they do charity events, if they do a certain type of dentistry, like dentures or whatever, you want to make sure you know what their niche is, and basically when they started, you know, a little bit background on them, because you want to bring that up in your interview. I told her why. I told her what I liked about their company. I told her what I can offer, what I've done. I've talked about my internships, my hands-on experience. I've worked with kids, I've worked with elderly, I've worked with mentally handicapped. So you want to bring those things up. You want to bring up your real world experience, like I said. She told me she'll call me in a few days. She didn't call me for a week. Dental offices are very, very busy. So if you don't get a call immediately, you know, call back, or maybe you can show up again. But they're very, very busy, especially the office manager. So you might not get a long interview. Like my first interview was like 2 hours long, because I had to go through 2 assistants and a manager with my interview. This interview was probably about 15-20 minutes long, and that was just because she really didn't have the time. She was busy, but she wanted to get in and out. A week later, she called me back. She said, can you come in for an interview tomorrow? I said yes. You want to make sure that you're readily available. At least, if you're a person that sleeps late, don't sleep late if you're looking for a job. You want to be up between the hours of 7 and at least maybe like 2, because those are the time that I found out that I realized I'm going to get a call for an interview. Between 7 and 2, when they got a break, whenever they got a break, they're going to call you. So she called me, said, can you come in the next day? I came in. I interviewed with the dentist. The dentist was very nice, very sweet. She asked me about my experience, and I can tell that she was willing to work with me and teach me, because dental assisting is very, like I said, on the job training. It's going to take you time. You're not going to get things overnight, which is why it's going to help you to have that background in dentistry and go to school for it. So she was asking me about it, and this particular place